died, and originally was told by COVID-19. Since then, is backed up to double check on that right now. I was wondering if you could go ahead and give us an update on where that investigation and where that case stands right now.
Yeah, well, so the autopsy results still have not come in as a final diagnosis yet, and there are lots of tests that some of them have to be sent out to outside labs, and so it may actually be several weeks before we get the final answer to this. Obviously, it's very shocking that a 4-year-old would die from any type of COVID-related illness. So that was part of the reason why we were very interested in the autopsy results, because we want to know whether she had underlying conditions that people were not aware of, or perhaps maybe there's something about this particular strain of the virus that not only was found in her, but also ripped through her family and made all of them very sick very quickly. That contributed to it. The preliminary results of the autopsy so far, again, are very consistent with her dying from COVID, and that's all the information we have at this point.
And should point, it's an important part of it. So far, the examination has shown
that's
that
correct.
It was likely COVID.
Right. And we don't have a final cause of death yet.
Is it though? Was it a mistake? Did it come out so quickly? In that, I mean, and I want to go over the sequence of things here. Is that obviously folks in the community were talking about it first, then the principal of the school announced it publicly,
right?
Then your office, when being asked about this, got with the medical examiner and said yes, it's COVID. Then the health district released that, and then it was the next day said, whoa, hang on, there's some questions about that. Are there going to be some changes in procedures when it's an unattended death, meaning not under the care of a physician at the time? Do you see that forthcoming not only within the health district, but as the medical examiner told you that at this point?
Yeah, I do think that we're going to, once we put this particular case behind us, we're going to get together and talk about the ways that deaths are signed out as COVID.
And I'll put it this way: was it wrong then to come out with the information the way it was, or was it it was just a?
Well, let's just say it was
communication.
And if I had to do it all over again, I might do it differently. But we at the time, the information we had, we were working with the best information that we had at the time. And it was already out there on social media and in the press, and the family was being vocal about it. And so, we knew we were going to be asked about it. So we proceeded with the best information we had at that point. But then, as we started scratching our heads about this and saying, well, wait a minute, there are a lot of questions here. Let's go back and revisit this and make sure we got this right.
And kind of a question here on it though too, is that you and I have talked about this, and we can see it in the comments every single time. Folks are going to question when they say, we've seen the folks say, oh, it was a gunshot wound, but they're going to call it COVID anyway because they tested positive. Right. What assurances can you give to folks? Because this one case right here, took a lot of folks that were doubters and gave them a big voice saying, look, see, this is all rigged up. What assurances can you give people that when this data comes out at noon every single day from the health district and it says someone's died of COVID, that is the absolute truth?
Well, if I think this case should reassure people, right? So it's a case where there were questions, and we're going back and we're relooking at it. So we're not just whitewashing things and saying that that cases are due to COVID. We don't count gunshot wounds of people who have a positive COVID test as dying from COVID. We review all of those cases. We've had that happen. We've had people who've died of trauma. Sometimes we have gray cases too. Sometimes we have elderly people with lung infections and bad heart disease and dementia and everything else, and they die. And it's hard to say, was COVID the primary cause of death, or was it a contributing cause of death? And in those cases, we report them as being COVID deaths, because we get accused of doing the opposite too. Just as we have people who say, oh, you're not counting COVID deaths because you're trying to undercount. We have people who try, I mean, people who say we overcount. We have people who accuse us of undercounting as well. So we do our best to get it right. And in fact, if you look at the state's website, you will see that we've actually reported fewer COVID deaths than the state has reported. And that's because we take the time to vet every death and to the best of our ability, make sure that we're giving you the right answer for each case.
To give it kind of in context here, how many of most of these cases would be similar to Kaylee Cook's, where there was unattended death?
Oh, that's very unusual, actually. That's
Mhm.
that's a very unusual case, and that was one of the things that, as we investigated the case, was that gave us pause.
And again, waiting on the results from